Please join me in welcoming these panelists for our session, Redefining Health for Our Community. Let's talk hypertension and kidney care. First up is our moderator, Kimmy Williams, who is a seasoned clinical research executive with over 23 years in the biotechnology industry. At AstraZeneca, she leads the Clinical Trial Diversity Initiative. Kimmy has driven clinical excellence at major biopharma companies and continues to shape the field through discussions like the one we are having today. Also joining us is Sandra L. Washington, who is a dedicated advocate for patient empowerment and health education, leveraging her own experience with chronic kidney disease, CKD, and diabetes to have a positive impact on the lives of individuals facing similar challenges. As the founder and CEO of the CHLMS MediHealth Foundation, Sandra actively advocates for greater resources and education to address common themes of lack of awareness, prevention, and patient resources. And finally, we have Dr. Marvin Sensical, a board certified adult nephrologist. Is that correct? All right. Who is currently a senior global development medical director in late stage CVRM at AstraZeneca. In this role, Marvin is responsible for the development and execution of late stage clinical development plans for registration, including pediatric development and life cycle management plans. Let's give them a round of applause.
So for today, let me start by letting you know I represent AstraZeneca. I don't know if that name rings a bell. I think it's important to let you know that at AstraZeneca, putting patients' healthcare outcomes, improving it, putting it first is key to our mission. So we do have a core value where we state that we put patients first. One of the ways we do that is demonstrated in the actions we are taking and our commitment around education, community engagement, and clinical trial diversity. So during this talk that we're having today, that is titled Redefining Health for Our Communities, let's talk hypertension and kidney care. We hope that we can provide a deeper understanding on the link between hypertension and chronic kidney disease. We hope that we can also highlight the impact of this diagnosis on a patient and also emphasize the critical importance of knowing your family's medical history. And also, finally, encourage greater advocacy for the inclusion of our Black and Brown communities in clinical trials. So my panelists here today will share their real life experiences from the patient's perspective, from Sandra, dealing with the diagnosis of chronic kidney disease. And then from the physician's perspective, from Marvin, telling us about caring for patients with chronic kidney disease and hypertension. By the time we are done within the next 27 minutes, I hope that we would have left you with valuable information that will guide the actions you take in the future around this topic. Thank you again for having us. So Sandra, I'd like to start with you.
Okay. Good morning, everyone.
So tell us about when and how did you find out about your diagnosis and how did you feel when you found out about
it? It was 3 years ago. I didn't find out from my primary care doctor. It was my endocrinologist. She had recently ordered some lab work for me. And when she got the numbers, she became alarmed because these were numbers that she wasn't used to seeing in me. So she was the one that called. And when my phone was blowing up 20 times, I was like, she must want something. Because normally the only time she would call like that is if she does want something. I had looked at my patient portal, so I knew that, or at least I thought I was okay. But it was her that actually called and gave me the diagnosis of chronic kidney disease. And you asked me how did I feel, correct? I was lost. And I was lost for this reason. I was so used to fighting for everyone else. Like when someone came to me with their issues, I was so used to going to battle for them with their issues that I had lost track of what was really happening in my mind. So I was taken aback. I was shocked when she said that. And we'll get into a little later about why I was shocked. But yes, I was shocked when I heard.
Well, thank you so much for sharing your story, Sandra. I can just imagine, figuring out what that diagnosis meant for you. Did you understand at the point when you received that diagnosis what it really meant for your healthcare and you as a whole?
To be honest with you, no. And that's because, look, when someone calls you in the medical field, and I try to get all providers to know this, when you give a patient an acronym, we don't know what that is. You telling me I got CKD? I'm like, okay, whatever. I happened to be on the way home from me and my husband have been out, and I happened to be on the way home. I knew enough as an advocate and as being someone that's been in the field for 30 years to go home and use Dr. Google to find out what CKD was. Um, but who else in here understand really when a doctor using an acronym what it is? So I was taken aback by the fact that this is what she told me, but no, I had no idea what it was. I didn't know until I went home and I did what I normally do, which was go home and use the internet to find out.
And I'm glad you brought that up because that's the reality with most of us. Even for many of us that are well educated, we still don't understand what those acronym means. And it's not just finding the full meaning of the abbreviation. It is what does that mean for me in terms of how I eat, right? What I do, what medications I take, how does that impact my interactions in life in general? So understanding that becomes very, very critical. So thank you for bringing that up as one of the area that we need to start looking at in the healthcare system. How are we educating our patients? Now, Sandra, I want to learn a little bit from you some more. What were some of the symptoms and contributing factors? Do you think family health or genetics played a role in
Well,
your diagnosis?
I will tell you some of the symptoms I was having, but this is the thing. Some of those symptoms I was having them because I was diabetic. I, was battling with diabetes. So me being tired, me going to the computer and looking at the computer and the computer looking back at me, knowing that it wasn't going to start unless I put something in there to start it, right? Those were symptoms that I experienced as far as diabetes. So the tiredness, the lethargism, which is tired, overly tired, right? I was feeling those, but I just really didn't know whether what it was coming from. I knew it was coming from something, but I didn't know what it was coming from, which is why my doctors, and this is a point that I do want to bring up, make sure you have a good medical team, one that you trust and they trust you, knowing that they would eventually come to the conclusion on what it was that was wrong with me. Those symptoms, I couldn't really say that they were coming because I was I was going through a CKD crisis. I just really couldn't say that. As far as the genetic part, I didn't know about the genetic part until my mom was transitioning over. And that's when my mom lived in New Jersey. I'm in Chicago. So we didn't have, like, I didn't talk to her every day. But when she was transitioning over is when I found out that I indeed did have a genetic disposition to it. So, yeah, it is, in fact, it's not to say all the time that it's genetically based, but for me, I do believe that it was the genetics did play a factor in it.
Thank you for sharing that. To that point, right, you can imagine if Sandra knew maybe years ago that maybe there was a genetic disposition within the family to getting chronic kidney disease, maybe she would have taken certain actions differently. And so when we talked about having these conversations at home, at our dinner tables, it's very important. The information we pass on to our children, right, to our grandchildren, can actually inform and empower them to make the right decision around their healthcare. Now, Sandra, one more point here. What were some of the pitfalls and issues you faced in your treatment journey?
Good question. My pitfall was my eating habits. Everything that I was eating, I thought was healthy for me, right? Because as a diabetic, I'm told monitor this, monitor that, monitor, everything. So here I am going about life thinking that, well, my diet is, helping me, when in actuality, it was literally hurting me. I was told, once I found out I had CKD, I actually started seeing a nutritional doctor as well. I was told no pineapples. Hold up, I've been drinking a pina colada smoothie every morning. Every morning I was having a pina colada smoothie. No bananas. Wait, hold up for a second. I was eating bananas to keep from taking them big old potassium K pills that they give you, and you telling me I can't have bananas either? And the rice. And my favorite snack at the time was popcorn. You can't have popcorn. And my husband's mouth dropped. Before my mouth did, my husband's mouth dropped. He was like, no popcorn? And I was like, but that's my favorite snack. And I was told no popcorn because the minute, and I'm not sure how many of us realize this, popcorn turns to sugar the minute you put it in your system. So while you're thinking it's healthy, it's not. So I actually had to learn how to eat better. I had to incorporate an exercise routine where I was doing more than being a couch potato. Those are the things that I had to do. But every person's body is different. The point is, you need to see a doctor. That's the point. But those were my pitfalls and my issues. And as my diabetic doctor told me, actually, my nutritional doctor told me, you can keep eating that if you want to. It's your life. You only have one. Take care of it while you're here. So those are my pitfalls and my issues that I had to get over. And I'm thankful to say that I have, for the most part. I fall off the wagon every once in a while. We all do. But I'm happy to say that I was actually able to do just that, was to actually get on a better spiel as far as exercise and as far as eating. I was actually able to pick up a better habit.
Powerful, powerful. Thank you, Sandra. So, Marvin, I'll come to you right now. Tell us,
Thank you.
how typical is Sandra's story for a patient with chronic kidney disease?
Yeah, well, unfortunately, Sandra's story is not is so common that I've lived through seeing patients like her for the last 14 years, and the difficulty with kidney disease is that it can be painless for many years. It can show no symptoms, and the only way people can define whether you have kidney disease or not, as Sandra said, is through lab tests. And in order to get those lab tests, you need to be seen by a doctor. And even though you do get these lab tests, sometimes it's up to the patient to say, how did my lab test show up? Because there are varying degrees of these lab tests where the doctor may or may not choose to address it with you. So that's one of the reasons why kidney disease goes on and not get diagnosed until a certain point where they become symptomatic, meaning where they develop symptoms. And at that point in time, it typically is at a more advanced stage. And so when you get to that point, you realize, I wish I would have known, and that's where the themes of empowering yourself and educating and asking the right questions and telling people to slow down and explain what this word that you just told me means, CKD, chronic kidney disease. What do the kidneys do? They clean your blood out, they control fluid, they maintain electrolytes. What does chronic mean? Well, that may mean that you have progressive disease that may not get better, and so I think it goes hand in hand with the themes that we've talked about. So
Thank
not
you so
very
much.
uncommon. Yeah.
I just learned a lot just now in this
Yeah.
1 minute. Thank you so much,
Yeah.
Marvin. So tell me, what type of support is typically provided to patients by care providers once they get this diagnosis? And I'll lump that with a second question. Are clinical trials seen as a treatment option for
Yeah.
patients with chronic kidney disease?
Yes, it's a very good question, and I think people view their healthcare providers, really with their first remit, and that is to make sure that you're healthy, make sure that they diagnose conditions and treat them, appropriately. But it does go beyond that, and as we talked about, it's education, it's empowering patients to understand, not only their disease, but at what level their disease is and how serious is it. And so and then it goes even beyond that. As Sandra had alluded to, there's nutrition, there's diet counseling, there's exercise. It's not just pushing meds and checking, blood tests. And I think people need to be aware of that. Regarding clinical trials as a treatment option, now, just some background. I'm a kidney doctor. I mean, Sonia had a very nice intro, but you can buckle that down into I am a kidney doctor. I treat patients with kidney disease. And I treated patients for about 14 years, and then I shifted my work mainly to research and development. And the reason why I wanted to do that was to develop new medicines to help slow the progression or halt the progression of kidney disease. And part of my work is developing clinical trials, which are basically programs that first and foremost provide the standard of care typically for patients. And what that means is medicines that you should be on and have the close observation that normally a doctor would do while you're investigating potentially new and breakthrough medications. So with that in mind, I mean, and I've kind of changed my career for this, is I do believe that clinical trials is an option for the right person and for the right condition. So thank you.
Thank you so much. So one thing became clear to me. Miss Washington mentioned that she was diagnosed with diabetes before, and I think in prior conversation you said about 20 years ago, before your chronic kidney disease diagnosis. What is the link between chronic kidney disease and other diseases such as diabetes and high blood pressure?
Yes, it's a very good question, and it's well known that diabetes is the leading cause of kidney disease worldwide. I mean, and we've known that for some time. High blood pressure or hypertension is also a contributor to kidney disease and adds to the damage to your kidney disease. But the thing people should know about is once you develop kidney disease, your blood pressure tends to get harder to control. So it can start to spiral and cause patients to progress even faster. So that's why it's important to understand where you're at and address these issues early. So there is definitely a link, as well as a link with genetics, as Sandra had said.
So if I understand clearly, if someone has a high blood pressure, it could lead to them getting chronic kidney disease. And if their chronic kidney disease is not managed well, it could make and worsen their high blood pressure. Is that what we are hearing here today?
Yep, absolutely.
Okay. So guys, you heard that. For any of us that's on HPP drugs, let's make sure we're managing that effectively. So Sandra, I'm gonna come back to you. Did your doctor ever mention participating in clinical trial?
No, my doctor hasn't mentioned to me clinical trials, and that's probably because right now, thanks to their good guidance and their overall treatment of me, I don't take medication for my chronic kidney disease. I am on medication for diabetics. Have to take one medication for diabetes, but herein lies where it's important for patients to know that they are the key to their health care is collaboration. I was fortunate enough to meet the folks over at Genesis Medical Research Group, and they started advising me on clinical trials. And so what I did was proactively now, I've done my own study. So when it comes time for me to have a clinical trial, you best believe I'm going to be one of those ones that do take part in clinical trials.
That deserves another applause. Thank you. So Marvin, one more, let me come back to you. So what are the options for patients if their physicians or caregivers are not aware of clinical trials or not making them aware of clinical trials? Where can patients get more information?
Oh, yeah, no, there's a variety of resources available, but it does take the first step in investigating it on your own behalf. But resources like our sponsor today, Black Health Matters, is one. There's a variety of different patient organizations like the National Kidney Foundation, the Kidney Health Initiative. There's an organization called NephCure. There's even a website from the government called clinicaltrials.gov, where you can just put your condition in and it'll list the clinical trials that are available and the sites that are participating in it. And it gives you more information on what's available. not to say that it's something you may or not do, but at least you know your options and what's available to you. So there's a variety of resources available.
Thank you, Marvin. And if you're all curious, at the AstraZeneca table outside, we have some resources there for you as well, where you can learn a little bit more about both chronic kidney disease and hypertension, but also where you can find out more information about clinical trials. So now I'm going to come back to you, Sandra. What will be your call to action for the people here today?
My call to action is this. We are now in the month of November, which is Family Health History Month. Our ancestors didn't talk about their health conditions, right? They kept it a secret. When they was talking, us kids wasn't allowed at those tables and having those conversations. Have those conversations. Thanksgiving is coming up. Have those conversations. Don't just talk about it, write it down. I have developed a journal. The dollar store has a journal. Do what you need to do to protect your health. No one is coming in our community to save us. Absolutely, positively, no one. We have to save ourselves. So my call to action is this. Do what you have to do, but get it done, right? You have me as a resource. I'll be at the table for a while. Use your resources. Make your health a priority. Make your health a priority. You have kids, grandkids, they're depending on you. Let's get it done. That's my call to action.
And Marvin, what is your hope for care in the space in the future?
Yeah. I mean, to echo Sandra's words, but really my hope is I really actually want to be put out of business. And the reason why I say that is because what that would imply is that we've achieved the ability to stop kidney disease among everyone. But the sense of urgency that Sandra says, it really does mean something. And I will tell you some facts that I know is that 1 in 3 Americans have kidney disease, but among the African American community is approximately 3 times at higher risk of developing kidney disease and 4 times as high a risk of developing something called dialysis, which means that they need to get on a machine to take over the function of the kidney. So the message of some urgency, I think, is really important. And with that, we can all work together to achieve our goals. So I'm with you.
Thank you. Thank you so much, Marvin. Thank you so much, Sandra, as well. So one last point for me, and then we go into question and answer. I'd like to ask you to get curious about clinical trials. Granted, right, we've had historical events that may have created mistrust around the idea of being in clinical trials. I acknowledge this. I also think we should acknowledge that we're moving in a better place now. The industry is looking at ways to ensure that we treat people with dignity, fairness, respect when we are inviting them to be part of clinical trials. The regulators are enforcing this as well. And it's important for us to understand that clinical trials actually add value to our care. When you're on clinical trials, someone is monitoring you religiously because they have to make sure that drug is effective and that you're not going through some side effects that they need to report. Also, you add value too. If we don't have a diverse population in clinical trial, then that means that we really don't know whether that drug works for the general population that has the disease. And so there's a value to be shared both on you coming in, adding value to the clinical trial process so we can verify that that drug works for everyone, but on the other hand, you benefiting from it as well. So I would just like to ask, my call to action is I would like to ask you to get curious about it, learn a little bit more about it, and if you have questions about it, there are people like me, people like us here, that would be happy to answer your questions. Thank you so much for this time, and now we're ready for questions and answers.
What stage of kidney disease are you in?
I am at stage 3. Now, what I want everyone to know is that most of the times before they actually diagnose you, you are at a stage 3. That's why it's important for you to start having these conversations. so that you can catch it at stage 1 so that you can get some help and it doesn't go to stage 3.
Second part, doctor, based on age, I know you lose some kidney function as you get older. How much does that have to do with the kidney treatment?
Yes.
And the second part is that what's the criteria for an individual to be a candidate for these trials? Stage 4, stage 5?
Yep. Those are excellent questions. And first off, just getting older, your kidney function starts to decline just by the fact that the kidneys start to wear and tear based on age. And so just being at a certain age, you walk in the door with already some lower kidney function. Your second question about clinical trial criteria, it really kind of depends on the type of study. So we, and a lot of researchers are looking at from stage 1 or no kidney disease to prevent kidney disease all the way to being on dialysis. So it really kind of depends, and there's always a study that you might be able to find that is on, based on your kidney stage. But I'm glad you asked about the stage, because I think I like to illustrate what those stages mean in just a quick way. So as Sandra said, stage 3 is typically when a doctor says you should go see a specialist, like a kidney doctor. Stage 4, and again, these are based on labs. Stage 4 implies that you're getting other issues related to your kidney function that might affect your bones, that might affect your blood count, it might affect, your blood pressure. And stage 5 implies that you're getting very close to dialysis. So I think to frame, the stages is very helpful. But to reiterate your point, we're looking at all the stages to try to prevent kidney disease.
Thank you for the information. I actually have a comment. I recently was providing care for my elderly sister who was diagnosed with chronic kidney disease. I'm loud mouth. I've got it. And the observation that I wanted to point out was something that's consistent with what you were saying, Ms. Washington, and that is coordinated healthcare is so important. And it's very important for she had hypertension, as a matter of fact, and people kept saying, well, are you diabetic because of the kidney disease? And it was a combination of things, age, medication. She was on, at least 20 different meds. And when I got involved with her care, when we went to the nephrologist, it was interesting because I loved her approach. She took a look at all of the medication that my sister was on and made some decisions about 2 different hypertension meds and some other medications that she was taking to remove because it was working against what they were doing on the kidney side. So it's very important, just as you stated, to have a good team of medical professionals who are going to take a look at your meds to see what the interaction is and what effect that it has on the kidneys. And to your point, doctor, her hypertension was like all over the place. And it took a minute to find the right med for her to lower the blood pressure, not impact the kidneys, and then the other things, the osteoporosis, just so many different things. So coordinated care is very important. And then I wanted to just add or to just comment on the clinical trials. I think that it's very important for people of color to be involved with clinical trials, because if we're not tested, we don't know that it works for us and for our body types and for things that happen in our system. So please, I encourage you, whenever you go to the doctor, have your med list with you, have them to print it out and have them to go over your test, because something that might work for this particular ailment could impact something else in your body. So thank you for that information. Thank you.
Would you explain mild chronic kidney disease to me?
Yeah, no, that's a good question. Because one would say, I have kidney disease, what's mild about it? And but what they're implying is, as the previous question was, is what stage you're in. And so typically, typically the earlier stages, like stage 1 and stage 2, imply that it's something that could be managed with just general medication or even no medication with diet, and there is little risk of developing the complications from advanced kidney disease. It's when you get to the lower stages of stage 3 to 5 is when you have that. So when in my head, when I would hear mild kidney disease or mild or early stage kidney disease, it's the very beginnings of kidney disease. I hope that helps.
I want to say thank you all. It's really, really great to be here. Take care.